This week on the Wheelhouse, the politics of hormones, barriers to gender-affirming care for kids who are trans, and who may break them down. For Connecticut Public, I'm Frankie Graziano. This is the Wheelhouse, the show that connects politics to the people. We got your weekly dose of politics in Connecticut and beyond right here. The Trump administration wants to bar hospitals from providing gender-affirming care to children who are transgender. But states are fighting back, challenging with the lawsuit that ultimately vacated a declaration from the U.S. Department of Health and Human Services to carry out Trump's directives on gender-affirming care. This hour, we're talking about access to gender-affirming care for kids who are trans and looking at how Connecticut lawmakers are responding. We're going to start with a look at how the White House has targeted gender-affirming care treatments for trans youth, and we'll do it with Lindsey Dawson. She's the director of LGBTQ plus policy at KFF. Thanks so much for being here, Lindsey.
Thank you so much for having me.
Folks, if you have some thoughts on the Trump administration's directives regarding gender-affirming care treatments for minors, hit us up 888-720-9677. Lindsey, since day one, the administration has targeted gender-affirming care. Literally a day after the president was inaugurated, came an executive order seeking to end what's being deemed chemical or surgical mutilation of children, unquote. That's what they said.
Exactly. So this started even before the president took office. Running and campaigning leading up to that election, the president really started to make gender-affirming care an issue that the administration was going to take front and center. There was a day one executive order that sought to define sex as simply male and female, effectively erasing transgender people. And then about a week after that, the president put out another executive order that really lay out the administration's all-hands-on-deck approach to limiting access to gender-affirming care, and especially for young people.
What are ways they've tried to enforce these actions that they've made, these executive orders? I understand at one point there was an FBI portal or something like that that launched in sort of some way to get civilians to turn in providers in some way. Was that something that was a thing?
That's right. So as I mentioned, this has been a real all-hands-on-deck approach, which is quite remarkable given that such a small share of the population is trans and that not all transgender people seek gender-affirming care. But the administration has done things like set up an FBI portal where people can sort of identify providers offering these services. But the biggest actions that have been taken have been proposed rulemaking and the declaration that you already spoke of that really seeks to dramatically limit gender-affirming care and stoke fear among providers as well.
Okay, so that's where we're going to go into next. I'm going to hope you could spell it out for me. In December, we had the proposed rules and the declaration. Could you describe each of them for us here?
Yeah, certainly. So in mid-December, the administration issued two proposed rules and a declaration. And before I describe the contents, I think it's important to understand that a proposed rule is just that. It's a proposal. It doesn't take immediate effect. It requires a comment period, which allows stakeholders to write into the administration and say what they think about the proposal. Do they support it? Do they not support it? And then the government considers those comments. And then if they issue a final rule, that's the regulation that takes effect. But in doing so, they also have to respond to the comments. And the two rules that came out were, the first one proposed to prohibit federal Medicaid funding from covering gender-affirming care services for youth. States could use their own state dollars, but it would be quite sweeping and limit gender-affirming care for youth covered by the Medicaid program. The second proposed rule that came out would be to prohibit hospitals that receive Medicare and Medicaid payments from offering gender-affirming care services to youth. The hospitals targeted by this rule is the majority of hospitals. And even if a hospital wanted to continue to provide this care, they financially just are not going to be able to do so. When you look at all of the healthcare spending that happens in a hospital, nearly half of it comes from Medicare and Medicaid. So hospitals are just not fiscally going to be in the position to say, we want to follow best practice medicine and offer these medically necessary services, but forego these payments that make our delivery system sustainable.
Here in Connecticut, we're told that hospitals have unwound their gender affirming care treatment programs, partially in response to this. And it really actually came in the summer, which was more closer to the executive action than it was these declarations. Reached out to prominent gender affirming care programs in Connecticut in reaction to the recent federal court order vacating a U.S. Health and Human Services declaration to bar hospitals from providing gender affirming care to children. Yale New Haven and Connecticut Children's Hospital did not respond to an email requesting comment. They announced last summer they'd no longer provide gender affirming care medication to trans children in their care. We did hear back from Middlesex Hospital. A spokesperson wouldn't specify the kind of care that they provide. In a written statement, Middlesex Hospital says it, quote, is monitoring the situation while continuing to provide the safest, highest quality health care and the best experience possible for our community. As you said, a lot of it has been sort of unwound and rolled back. Hospitals having a tough time because there are some financial reasons there, obviously. But what are the states doing in response to this declaration?
Yeah, no, I think what we've stated is important about where the hospitals are going. And when they did roll back care earlier on, even in this happened across the country, right? This wasn't just something that happened in Connecticut. But almost every health system in public facing comments, including Connecticut Children's and Yale, directly tied rolling back that care to a complex and threatening legal environment, and to these executive actions. And so there has been a back and forth with states and responding to how their providers are responding to both the executive order, but also these proposed rules and the declaration, which we can get into if you'd like.
Yes.
And, I think providers are stuck between a rock and a hard place, particularly in states like Connecticut, where there might be non-discrimination policies. Providers do not want to be sued and have their entire programs dismantled, but they do want to provide the best practice care. And state AGs have at different points in time sort of pushed states to re-engage in this care, but are also aware of the environment in which these providers are operating. And so it is deeply complex.
Yeah, and you talked about individual attorneys general. Maybe Letitia James is somebody that's in New York. I'm not sure if you have any awareness or idea of that situation versus others, because it seems like New York, maybe some of the care might be more active than it is here in Connecticut. I'm not sure the scale of access versus the two, but it seems like there might be a little more care available in New York.
Even in New York, we've seen care rolled back.
Sure.
I think the AGs can come out and say, we want you to continue to provide this care, and you could be in violation of state law if you don't continue to provide this care. But providers and provider legal and counselor is still in a tough place of trying to figure out, what can their providers do, and both be in sort of in not in violating state law, but also without threat from the administration. And so it's an increasingly difficult position for them to navigate. And we are seeing states challenge some of this. We haven't seen challenges to those proposed rules because they are proposed, but we would likely see challenges if they were finalized. We did see challenges to the declaration, including by Connecticut. And the declaration was recently vacated by the court. That declaration was a little bit different from the proposed rules because it actually sought to develop a new standard of medical standard for healthcare, which is deeply unusual. Usually we see medical standards from professional bodies like medical associations, or maybe a guidelines group organized by the federal government made up of professionals and subject matter experts. And so to see Secretary Kennedy pursue a declaration and try and develop a standard of care was very unusual. And the court found that, in fact, he lacked the authority to unilaterally establish standards of care.
This is Oregon v. Kennedy that you mentioned, and this is the decision that you said that vacated the declaration. But yet, even though that declaration is vacated, we're still in an environment where hospitals are not comfortable providing a full range of care, it seems like.
That's right. That's right. That declaration has been vacated. The proposed rules linger, but we have seen just continued pressure from the administration that puts providers in a really difficult position. For example, right after the declaration, officials started tweeting that the Officer of Inspector General would investigate providers based on that declaration. And so I think it's a little bit of a cat and mouse where providers are really trying to figure out what they can do and how they can best serve their patients without being in violation of sort of federal policy.
Another recent ruling involving gender-affirming care that I want to talk about here that I think you can help me out with here. A U.S. Supreme Court decision last month came down against the state of Colorado's ban on conversion therapy. I want to make sure I have that right. What does the ruling mean in the landscape where gender-affirming care treatments for minors are being targeted?
Right. So conversion therapy is a widely condemned practice. All the major medical associations across the United States criticize it, state it lacks evidence, state it's ineffective, and it can create harm. It's when a provider seeks to change somebody's sexual orientation, typically from being LGBTQ to heterosexual or cisgender. And nearly half of the states have bans to protect against healthcare providers, in this case therapists, from engaging in conversion therapy. Colorado therapists said that they wanted to be able to provide these services to their clients and sought to challenge the state ban. So before the Supreme Court was the question, does the Colorado law censor speech between therapists and their patients based on viewpoint? Does it violate the free speech clause? And in order to sort of tease that out, the court had to decide, did the ban speech purely, or is it actually banning a practice or conduct where speech is incident to that conduct? Interestingly, while the court said that the Colorado law is an egregious assault on free speech, it technically did not invalidate the Colorado law. The nation's highest court sent the case back to the lower courts to apply a stricter standard of scrutiny. And so we'll see what happens in those lower courts. But they were pretty clear that they saw that the Colorado law does violate speech and that it was purely about speech. But it is a bit of a, we need to wait and see what happens at this point in time.
And could you just at least, as we finish up here, try to get into the fear with that ruling? Is it that this could be adopted in a larger setting or excuse me, in other states or other cases?
Yeah, I mean, I think, it could stand to threaten what these laws from being able to stand in other states. Importantly, the court did not weigh in on the safety or effectiveness of conversion therapy. The fear is that these practices could be more widespread without protective laws in states. And while individuals could still bring suit against practitioners for individual harm, it is not as sort of protective as having a state law that protects against a practice that is widely seen as harmful.
Questions about this case or anything else that is happening in the administration right now related to this topic, there is a policy tracker at kff.org, which Lindsey Dawson has contributed to, KFF's director of LGBTQ plus policy. Thank you so much for coming on the show, Lindsey.
Thank you so much for having me.
After the break, we zoom into Connecticut and how access to gender-affirming care has changed under the Trump administration. Questions on what you've heard so far, hit us up, 888-720-9677, 888-720-9677. This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. You heard last segment about the White House's attacks on gender-affirming care, treatments for minors. Now let's talk about how families in Connecticut are impacted. Melissa Combs is an organizer with a queer-led grassroots organization dedicated to LGBTQ plus rights advocacy called Equality Connecticut. Melissa, thank you so much for being here.
Thank you for having me.
Thank you for coming up here and coming on the show. I appreciate it. Jona Tanguay is the president of GLMA, GLMA, Health Professionals Advancing LGBTQ plus Equality. Good morning, Jona.
Good morning.
I appreciate you coming on to talk to us as well, Jona. If folks have questions regarding gender-affirming care, someone you know having to go out of state for their treatments, give us a call, 888-720-9677. Jona, I'm going to ask you the first question. When transgender children seek care, can you help us understand the range of gender-affirming care that they may be looking for, if they are seeking it at all?
Yeah, absolutely. I definitely think a lot of this care has a lot of stigma around it, and there's a lot of speak about it, and there's a lot of misinformation. For the majority of trans youth, it really is actually just counseling and mental health support and affirming mental health support as they may explore their gender and also just sort of seek care. For older adolescents, there may be hormone therapy or other sort of medical treatments. For some of the younger adolescents, there may be puberty blockers. That is something that definitely also is over-indexed in conversations. It's not something that is necessarily widely used, but it is a very important medical intervention for a select number of youth. And then finally, there's surgery, which again is a very small population, usually of older adolescents that are seeking surgery. But that's sort of the full range of care in terms of medical treatments and behavioral health treatments. But the really important thing, I think, for people to remember is that the most important thing is access to affirming mental health services. And that is usually what is utilized the most.
What's available to folks now for the context of this conversation, and what might not be available?
Yeah, so it really depends on the states because depending on what state you live in, there are different kinds of care brands. I would say in the current landscape, because what we're mostly seeing is hospitals shut down their programs, what has really been restricted is access to surgery for those few that are seeking surgery. But hospital programs were also some of the larger providers of some of the medical treatments and also counseling too. A lot of them had interdisciplinary centers where they had counselors, surgeons, and prescribers of hormone therapy, endocrinologists, et cetera, all working under one roof. So when those places closed, a lot of these long-term relationships that these trans youth had with clinicians that are really important to have those relationships, those good relationships, that great rapport, were injured. There are usually still, depending on what state you're in, smaller individual clinics or community health centers that are sort of providing this care, some of them more discreetly. And they can usually provide some of those mental health services as well as the medical treatments like hormone therapy and in some cases blockers. Although for some smaller clinics, actually the blockers is a little bit more difficult to provide. But surgery is definitely where we would see the biggest restriction in access. But just in terms of these closures, because these hospitals oftentimes provided multiple different kinds of services, it is just more difficult to find care. And also it's difficult for families to sort of have to transplant to a new practice, especially after establishing some very important relationships.
Difficult to find that care, but from a linear perspective too, that likely means going private and also paying more money for this care?
Oftentimes, yes, if it's a smaller individual clinic, although there are many community health centers that also will, oftentimes federally qualified community health centers that will provide this care. But unfortunately, similar to hospitals, a lot of those community health centers are also very vulnerable from some of the threats that are going on. A lot of them are still trying to find ways to do it, but certainly, yeah, it could be that it's a private pay system, and so that can be difficult for families. Especially for families that may be using public insurance, it can be more difficult to find a provider that's accepting new patients as well. And you can also have a lag as well, because as you know, if a clinic shuts down overnight, you usually can't get an appointment like the next week, there's usually a little bit of a lag there. So certainly it causes a lot of distress on the whole family when they suddenly become sort of like displaced from medical practices and having to find a solution. And it's even worse, of course, for families in states where it's a total ban. And we are seeing a lot of displaced families having to actually, in some states, travel out of states to seek care. Luckily, that's not as much the case in Connecticut as of yet, but certainly even when a hospital closes down its practice, it can be something that's very difficult for families.
Displaced, good word to use. Thank you for introducing that to us in the context of this conversation. Melissa Combs is from Equality Connecticut, in addition to lobbying on behalf of the Out Accountability Project and organizing for Equality Connecticut. You have a child undergoing gender-affirming care treatments. First and foremost, how's your kid doing at this time?
Well, despite the hostile national climate, he is thriving, but that speaks to the extraordinary effort that all parents and caregivers have to put in to ensure that their child is thriving. And obviously with the loss of access to care, that made things more difficult. So, but he is in a great school with a great learning environment, a supportive learning environment. As a patient of Yale, we've found care, and we are actually going out of state to find that care, because there is a healthcare desert that's been created in the northern half and southeast parts of Connecticut because of what's gone on in the past year. But he's great.
Can he get certain services in Connecticut and then go out of state for the other ones, or is it all pretty much?
Well, it depends.
Sure.
CCMC completely shuttered their program. It's just gone. Yale took a different tack, and they stopped prescribing to adolescents. And that means that their program remains open, and they have expanded their mental health supports in addition to some other things that were a part of their program, like their parent support groups, teen support groups, things like that. So they have remained open. They just can't prescribe. So if you have an adolescent on puberty blockers or hormone therapy, you are having to go to a different practice to get that.
You'll hear what we spoke about in the last interview when I talked to Lindsey, the situation that hospitals find themselves in. So it's like that crude math I think we were talking on the phone about earlier this week, where we have a small subset of kids here and so much dollars that come in here for Medicaid and, of course, Medicare. So that's kind of the situation that kids find themselves in at this time, really victims sort of this crude math, would you say?
Absolutely. And, let's be real for a second. These hospitals faced extremely challenging choices. In Yale's case, they were looking at losing over $3 billion in patient revenue from Medicare and Medicaid. In CCMC, we calculated it to be somewhere around $700 million. And legal counsel at both institutions are the ones who made this decision. And, really, trans kids didn't stand a chance against that.
Before the declaration.
So Yale and CCMC made changes to their programs in July of 2025. This was about 5 months before the Kennedy Declaration came out.
So it's understandable, or not understandable, but I guess it's remarkable that the declaration came out and then there was the vacated order, but yet we don't know if anything's changed yet.
Well, right. While the decision out of Oregon is glorious and that there's a lot of wonderful language in it, many thanks to that judge for recognizing that. Again, we have to remember that Yale and CCMC made these changes 5 months before, and they were inspired by different federal actions that had started, January 20th, as I believe it was Lindsey mentioned. It wasn't just executive orders. I would say that the provider community, caught wind of these potential CMS rules that were going to be proposed. And there was a lot of talk about those. But then really, I think the biggest chilling factor was in June of 2025, the Department of Justice issued 20 subpoenas to hospitals, children's hospitals around the country. Now, we know from court documents and just others choosing to talk to the press that Boston Children's got one of those subpoenas, and they have doubled down on remaining open. We know that the Children's Hospital in Philadelphia got one. We know a hospital in LA got one. But CCMC got that subpoena too, which is not widely known. But that is really I think the motivation for what happened.
A big part of the chilling effect, you're saying. Thank you for making that declaration or that point. I just want to make sure that I note that I reached out to try to get some kind of clarity from Yale and Connecticut Children's, and I didn't hear back. But nonetheless, I did reach out. Listening to Melissa's story, Jona, is this something you're hearing a lot about?
Yeah, absolutely. There's a lot of fear out there, and I think in such large hospital systems, as been said, it's really scary for them. I think in America, our healthcare infrastructure just generally is already so strained, and they're very risk-averse systems. And we're talking about systems that are caring for a lot of people, like very many people, and that are doing so from thin margins. The thing I also want to highlight, though, is that when a lot of these places have closed their programs, they don't cite changes in medical guidance or evidence or the evidence base. They really are just citing fear of retaliation by the administration or other sort of issues. And I think that really just shows that the motivation for this is not changing opinions of providers, not a change in the clinical evidence. It really is just fear of sort of government action against these different systems. So I think that really goes to show what the main driver of all of this is.
From Connecticut Public, this is the Wheelhouse. I'm Frankie Graziano. You've been listening to Jona Tanguay of GLMA and Equality Connecticut organizer Melissa Combs. They're not going anywhere. After the break, how are states responding to Trump-era action against gender-affirming care? Hit us up, comment on our YouTube live stream, or give us a call, 888-720-9677, 888-720-9677. I want to note that first, we are in the middle of our spring fund drive at Connecticut Public, and you can ensure that the Wheelhouse continues to cover nuanced topics just like this one by donating to Connecticut Public. Here are a couple of friends of mine to tell you how to do it.
Hello, I'm Matt Dwyer, here with Morning Edition news producer Jenny Ahrens. We're here to ask you to give us money to support our work. You can do that by going to ctpublic.org and clicking on the red donate button in the upper right-hand corner. It's got that little heart thing there. You can also call 800-584-2788. I want to also mention that this hour's challenge is sponsored by the Greater Hartford Gives Foundation, formerly the Hartford Foundation for Public Giving, working with people like you to create a strong foundation for the region. And I should also mention as well, Jenny, this is a special hour here. We have a dollar-for-dollar match up to $1,000. That's our goal is 7 donations for this hour. And how are we doing right now, Jenny?
Well, thanks to Rachel in Watertown, we're already one down.
Yay! Go Rachel! Thank you.
So Rachel, your money literally just doubled because of that. Because of that great sponsorship, that great matching by the Greater Hartford Gives Foundation. So Rachel, thank you so much. So be a Rachel. You don't need the haircut. You can just be
yeah. Okay.
I don't know how many of you get that reference, but you know my generation now. And just so Rachel and anyone else who gives during this pledge drive, just want to let you know that you are helping us give award-winning coverage of the region, of your state, of your towns. This April, Connecticut Public received 16 regional Emmy nominations. Yay.
Go us!
Yes, Connecticut Public's visual team earned multiple national honors from the National Press Photographers Association, and I'm going to continue giving us props. Generation Barney, a 7-part podcast from Connecticut Public, won a bronze at the 4th Annual Signal Awards. And I could go on, but I think that'll be a bit Is that bragging?
So many awards. So many awards.
But we are able to do that because of you. So if you can, give at ctpublic.org or call us at 1-800-584-2788.
And Jenny, it seems to me too like the Wheelhouse, the show that we're listening to right now, it seems like a very good example of like the kind of show that deserves to be supported that we produce here. I mean, we're Frankie and his crew are spending almost an hour here to take like an in-depth look at the issue of gender-affirming care without letting the issue just kind of like devolve into diatribe. Some other places online that might happen.
It's an issue that can't be done in a TikTok.
Yeah.
It can't be done in a 8-10 second soundbite. It takes measured, calm discussion. Mm-hmm. And that takes 45 minutes if you that takes, well, it could take longer, but at least 45 minutes. And we give that time to topics that people care about.
Yep. And the producers of the show, they had to take the time to find the people who know the topic, who are knowledgeable, and people who have direct experience, and then book them and get them in. And the people that do that work, they need to get paid at least a little bit. And I think it's worth supporting that work, to inform people and give them reliable information and people talking about their personal experiences, and that can be very powerful and informative. And anyway, to support that work, you can go to ctpublic.org or call 800-584-2788. And if you go to the website, you just look, and it's in the upper right-hand corner of the website. It's a little red button with a heart. So please go there.
But don't look if you're driving.
Yeah. Good
Pull
point.
over.
ctpublic.org, 800-584-2788. And thank you.
This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. All hour, we've talked about the politics of hormones and the access to gender-affirming care. We're going to finish up now by talking about ways Connecticut officials can preserve care. Still with us, Melissa Combs, an organizer with a queer-led organization dedicated to LGBTQ plus rights advocacy called Equality Connecticut. Thank you so much for being on the show today. Jona Tanguay is the president of GLMA, Health Professionals Advancing LGBTQ plus equality. Thank you so much for coming on, Jona. Not a lot of time left in the show, so if there's something you want to talk about, access to gender-affirming care, call us now, but do be brief, 888-720-9677, 888-720-9677. Melissa, Connecticut has a shield law to protect reproductive health. I know this is something you know about, and you were actually recently at the Capitol understanding what was going to happen to this law. Before we talk about its expansion, what is the law that's in place now?
So for context and background, in 2022, the Dobbs decision it came out from the Supreme Court, and it eliminated federal constitutional protections of abortion care. And even before the decision was released by the court, several states like Texas put in trigger laws. In other words, they were anticipating a favorable decision that would, again, eliminate access to care. And so these laws went into effect as soon as the Dobbs decision came out and eliminated that care. So it ranges wildly. There are 19 states now that have extreme restrictions on abortion care or outright bans, and criminalizes health providers, or providing this care. So what happened was, anticipating here in Connecticut in 2022, they enacted the SHIELD law, which protects providers from out-of-state bad actors attempting to enforce their own state laws. And so the SHIELD law was enacted in 2022. Since then, advocates, a group of advocates have worked together to expand the SHIELD law. And the SHIELD law now includes all legally protected care, like gender-affirming care. And it also, this year, we're expanding the telehealth protections. And I will add that this is an excellent example of how a state can mitigate the harm done by federal actions like this. And so the same sort of strategy applies regarding these attacks on gender-affirming care. So it's, we have a duty to protect our providers and access to care for our residents. I will also add, Connecticut was the first state to enact a SHIELD law, and now today, 22 states plus D.C. have a SHIELD law. And in practice, the best example I can give you, the most public example, is Dr. Carpenter in New York. Louisiana issued a warrant for her arrest, and Attorney General Ken Paxton in Texas came after her as well. And the New York Attorney General was able to use their SHIELD law to reject the extradition request and the request from Texas.
This SHIELD law expansion, you mentioned telehealth. Could you just get in a little bit to the finer point to where it would protect telehealth, at least from lawsuits, especially if you're an out-of-state provider? You're in Connecticut providing to somebody else, because you could have a license across multiple states. And then there's also on the prescription bottle, there could be a change as well, where you wouldn't have somebody named. Is that correct? A doctor to protect them from doxing or something like that?
So going back to the example of Dr. Carpenter in New York, Louisiana and Texas got her name because it was on a prescription pill bottle. There is a bill that's been introduced in Connecticut this year to change the requirements for what is on a pill bottle. So instead, it would list the health system, like it would say, Yale New Haven Health. It would not list the provider name. And the same would be true for, of course, any gender-affirming care type prescriptions, to protect people from doxing and death threats and all of it.
You've been there. You've been a part of the conversation. Do we know if this will come up anytime soon? Are those separate bills, or are they in the same thing?
So the SHIELD law is its own bill. It's Senate Bill 295, and we anticipate that it will be called to the Senate floor any day. So we're at the Capitol every day waiting for that. The prescription pill bottle bill is a different bill, and I'm not recalling the number, and it is working its way through the system as well, and we also hope that will be called to the floor to provide that additional protections, not only to providers, but to patients too.
I appreciate that distinction, because now we can track the two different bills. I thought they were one for some reason. Thank you for making that clarification. Appreciate that. Jona, as we've discussed this hour, the federal government has taken several steps in Trump's second term here to ban gender-affirming care. Attorneys general, including in Connecticut, sued the Federal Department of Health and Human Services for a December declaration to, quote, end the practice of sex-rejecting procedures on children that expose young people to irreversible harm, end quote. That declaration recently was vacated by a federal judge of Oregon v. Kennedy. So trans kids would still be able to access everything they need, right?
I mean, theoretically, but as we kind of discussed before, all of this is just also like it's a fear tactic. They're trying to make families afraid and providers afraid. And I think also they're following the same playbook for gender affirming care that they are also for reproductive health care. In terms of making providers afraid of providing this care. I think we kind of mentioned it before, like as things currently stand, could hospital systems still provide this care? Technically speaking, depending on where you are, yes. But again, that's certainly state dependent. But there are very real reasons why they are concerned about this. There are things coming down the pipeline, which even though there will probably be continued legal challenges for every new thing that they actually produce, it still can be what it really just does, though, is it creates sort of like um, uh, a fearful environment for providers and for systems. And I think also, especially when we think about what could like potentially eventually come and what they've done in some states, for example, for reproductive health care, threatening people's licenses and other things like that. This again is a risk averse community of providers, and then also systems. And so yeah, it's the culture of fear that's really going on right now.
You talked about providers there. How are they handling the ruling here? How are providers that you talk to? How are you doing?
There's a lot of fear, there's a lot of concern, and there's a lot of education that needs to happen. I think that providers, they hear something, they don't necessarily, we're not all legally trained, of course. That's not our jobs. We were trained to provide care, and now it's gotten complicated. And so people can feel very easily overwhelmed. They don't necessarily understand what happens when something has like an injunction and sort of what the legal landscape is and what actually is and is not a threat for them. So we see a lot of fear and a lot of requests for information, which is why community organizations and legal organizations are so important, and why there's a lot of educational work that is ongoing and needs to continue to happen to providers and to systems about what actually is the current state of things, what are the risks, and what aren't the risks? Like, can you still be providing this care? Of course, we would hope that more systems would sort of stand up, and some have, as mentioned earlier in this show, and just really stood by providing this care. But it's certainly a confusing landscape for many. There's a lot of fear amongst providers, and that's very much intentional. They want providers and systems to not really feel like they know what's coming next, and what's okay to do and what's not okay to do. Because when there's confusion, that's usually when people will just kind of throw their hands up.
And the reason why, before I bring you in, Melissa, the reason why is because there's a license. People might be worried about losing their license. There's a lot of there's also doxing, I would imagine. So help me understand that culture of fear that's sort of capturing folks right now at this time.
Absolutely. It's about, I mean, a lot of it just comes down to the money. It's about funding for clinics and systems, which of course is very important. And there's a lot of patients that we need to take care of and that providers have attachments to, and they want to make sure that all of that care is still able to go on. The medical community, one of the reasons why it is risk averse is that we are very litigious people. In America, and you work a very long time to get a medical license, which then is like the way that you support yourself and you try to help others. I mean, people are very concerned about that. It's obviously there's a lot of sort of like legal things surrounding the license. And so I do think that is actually one of the sources of fear as well that doesn't often get named, is people are worried about doing something that's going to sort of like threaten their livelihood and continue to be able to provide care, not just about the funding systems on the larger scale, but on sort of the smaller level. People are afraid of what that could mean.
Melissa, Connecticut is a so-called reproductive rights safe harbor. This is a lot of the conversation we've had since Dobbs v. Jackson was overturned, and since that decision was made in 2022. So what does that mean to you?
Well, if we truly are a safe harbor, then we need to be restoring care in the northern half and southeast parts of the state. Many families in Connecticut are traveling to Massachusetts, Vermont, and Maine for care, and we shouldn't have to do this. This is evidence-based, medically necessary, and legally protected care. And while I can understand why legal counsel at Yale and CCMC made the decisions that they did, really it's time for the state to step in and using the similar playbook related to how the state responded to Dobbs v. Jackson, and really make sure that no Connecticut resident has to engage in medical tourism for this life-saving care.
This is the last question, and tell me what you can here, because I know that there's a lot that's sort of in flux, but what recommendations can you give to people? What would you tell people to do?
I would say if parents, caregivers have questions about accessing gender-affirming care, they should contact Equality Connecticut. We're happy to talk with families and with adults receiving care if they have questions, because many adults have lost their insurance coverage, federal employees, veterans, etc. Any questions, contact Equality Connecticut. We're happy to answer questions. The website address is eqct.org.
Jona, 20 seconds. Tell me what you would recommend really quickly.
Yeah, I mean, ideally, if there are families that have sort of lost care, there are directories out there that you can try and find care on, things like the LGBTQ healthcare directory and others to try and help find other providers. Ideally, systems would also participate in helping families find alternative care if there have been changes, although I absolutely also agree with what was said about, like, hope in the future. We hope that more of these clinics and systems get the support that they need from the state and from legal counsel to reopen their doors.
Jona Tanguay, the president of GLMA, Health Professionals Advancing LGBTQ plus Equality. Thank you so much for coming on the show. Melissa Combs, organizer with Equality Connecticut. Thank you for coming on. Today's show was edited by Patrick Scahill. Dylan Reyes is our technical producer. Thank you so much for listening and watching the Wheelhouse today. Have a good day.